We have more for your ears only. I'm Eddie Robinson.
I'm David Alpern with this quote from the news. We should begin by ending the arbitrary division between Part A and Part B. That was Virginia Republican Congressman Eric Cantor last month on a reform of Medicare that President Obama more recently echoed, which could be the start of a grand bargain to cut entitlement costs and raise new revenue to shrink the budget deficit. Also last week, a study in California suggested that Obamacare could raise premiums for people 20 to 30%. Now this.
The Da Vinci system is the most advanced surgical platform available in today's market. The Da Vinci system consists of an ergonomically designed surgeon console and a patient-side cart with 4 interactive robotic arms, one to hold and position the high-resolution stereo endoscope, and the second, third, and fourth arms to control high-precision, fully articulated endo-wrist instruments.
Is this the future of surgery, American style? The Da Vinci system, as described in that promotional video, combines a high-definition 3D visual system for human doctors and remote controls for ultra-precise manipulation of scalpels, suction, clamps, and other high-tech tools of the trade for prostate, colon, rectal, gynecological, thoracic, and weight loss surgery. Increasingly publicized and accordingly popular, however, this breakthrough technology also has been linked increasingly to complications for patients, according to an advisory letter recently sent by Massachusetts health officials to hospitals throughout the state.
In some cases, it appears that doctors have used the heavily marketed robots to perform hysterectomies and colorectal operations too complex for the technology, leaving patients with severely damaged internal organs and excessive bleeding. According to the ECRI Institute, a national medical organization in Pennsylvania, robotic surgery is booming despite limited evidence that it works better than standard operations. Boston Globe healthcare and medicine reporter Liz Kowalczyk reported that story last week, and for your ears only, she's on the line now. Welcome to the program.
Thank you for having me.
Talk about the warning letter state health officials sent out. What are they telling hospitals to watch for or avoid?
Well, state officials wanted to alert hospitals to the fact that they're seeing a growing number of complaints and patient injuries due to robotic surgery. So they want the hospitals to make sure that surgeons are proficient in robotic surgery before they operate, that they're carefully screening patients to make sure that only patients who really qualify for this type of surgery are having it. And they're also advising hospitals to establish better oversight of this type of surgery so that they can monitor the results.
And what was the hospital's response in terms of actual use of the technology and the marketing of it?
Well, I think it's too soon to know whether the hospitals will decrease, whether they'll step back in terms of the numbers of surgeries they're doing. We'll have to see how that unfolds over the next few weeks.
What is the cost of technology, this technology to hospitals, and the benefit they get in terms of fees that can be charged for it versus standard surgery?
Well, the cost of the technology up front, the capital cost, is about $1.5 million. But that doesn't include the yearly maintenance by the company that makes the robot or the disposable instruments that must be constantly replaced. The problem for hospitals is that insurance companies do not reimburse them any more for robotic surgery than they do for regularly, minimally invasive surgery. And that means the hospitals need to make up that capital outlay with volume, with patient volume.
Urologists urged Massachusetts General to buy a robot in 2007 because the hospital had been fielding calls from interested patients. The hospital purchased one but decided not to advertise it. Why?
Mass General just didn't feel that the evidence was there, that the evidence was strong enough that robotic surgery was better than other approaches. So they decided not to advertise. Still, they did buy a robot, and I guess you could see that as succumbing to market pressures, but they say that they were getting calls from patients asking for this and that patients would have gone somewhere else if they didn't buy the robot.
You talked about the complaints being fielded in Massachusetts. What about the findings of that ECRI Institute on outcomes of robotic versus traditional surgery?
Well, this has become a national issue. There are lawsuits being filed across the country. There are law firms now across the country that specialize in robotic surgery claims. So ECRI, which is a national research group, looked at all the evidence, all the studies that are out there, and they found that there was no proof, no convincing evidence that robotic surgery was better than more traditional approaches for a variety of procedures.
What did you learn about the amount of training surgeons get on Da Vinci and other robotic assistants, and the kind of updates they should or could get as the technology is improved, refined, maybe restricted in some situations?
Mm-hmm. Well, the company itself says Intuitive Surgical says they provide a day-long training course for doctors. That was rolled back from what they initially told the FDA, which they would provide, which I think was 3 days. In terms of the additional training, how many cases, for example, a surgeon needs to assist on before he or she can operate on their own, that'll vary by hospital, and it's really up to the hospitals to set a lot of these rules and make sure that the surgeons are proficient.
How can patients better separate the marketing hype from the reality when considering robotic surgery for a specific operation? What questions should they ask about their doctor's training and experience with the new technology? Are there minimum acceptable answers?
Right. I think it's very difficult for patients to evaluate this in the light of all the advertising going on. And, some patients are very enamored with technology and very driven by that and want that. But I think it's important for patients to ask doctors how much of the experience they have operating with the robot, and not only operating generally, but doing the specific kind of surgery that the patient's going to have. How many cases have they done? How many have they done on their own? What have their results been? And then beyond that, patients can go to ECRI's website, ECRI.org, and look at what they've found, look at the studies, and look at their analysis of the studies.
Boston Globe reporter Liz Kowalczyk covers healthcare and medicine.
Quote from the news, "You learned an awful lot of law just from reading Tony Lewis's accounts of opinions." That was Joseph Lelyfeld, former executive editor of the New York Times, after the death of Anthony Lewis, 85, whose Supreme Court coverage raised the level of all legal journalism.
Next, Behind America's Birth Certificate for your ears only.